I'm Joe Chili, mornings from 7 to 9 on Buffalo's oldie station, The Big Weck. Joining us on The Big Weck's Buffalo on the Rise today is Dr. John Zilliox from Positive Health and Wellness Chiropractic. Doctor, nice to see you.
Joe, nice to be here.
You know, it's always nice to see a doctor when it doesn't cost me any money.
That's correct.
I always enjoy that. How long you've been in practice and what kind of practice do you do?
Joe, I've been in practice for almost 40 years. 1985, I started in practice. My practice has ventured outside of chiropractic, and I'm also a licensed New York State nutritionist, dietitian, so we implement a lot of nutrition in the practice. But we've gone beyond chiropractic in terms of the kind of conditions we see in the office. So we use a lot of different types of therapies to treat different types of conditions.
You know, one of the things that I think that you talked about, and you may have even done a book on this, is about knee pain, something that's very chronic with individuals. And you have a book, No More Knee Pain. It's actually the name of the book, right?
That's correct.
Tell us a little bit about this, and is it an alternative to having knee surgery?
Great question, Joe. I just had a seminar today. We had 27 people at our seminar in the office, and a lot of these people who are facing knee replacements are looking for an alternative. Now, I don't discourage people from having a knee replacement, but however, there are alternatives to improving their functional quality of life. So I integrate a lot of different therapies, which are on my website, and I show the people in the seminar the therapies we use and how it's effective, and plus a lot of testimonials. People who were told they're bone on bone, that they needed knee surgery, have been able to escape that.
You know, knee surgery, back surgery is another thing that we hear, and I have to tell you, you know, I've talked to people that have had back problems, and 9 times out of 10, they say the last thing you want to have is surgery. You know, try anything else before that. And you've also done a book with regard to that, right?
That's right, Joe. My book is The Non-Surgical Solution to Back Pain. And what it revolves around is non-surgical spinal decompression. Now, I've been doing non-surgical spinal decompression since 2007, and it's an amazing therapy, clinically documented to 87 to 92% success rate in terms of treating herniated disc, bulging disc, protrusions, stenosis, and things like that. So really, people who have been told they need surgery, generally going through non-surgical spinal decompression can avoid that.
You know, one of the things that, and this is a misnomer, I'm sure, one of the things that people think about, and I've thought about as well, when you go to a chiropractor's office, you think of cracking and, you know, things like this. And you don't use those regular type of therapies. You have different methods that you use, right?
I do, Joe. I mean, I used to use manual manipulation quite a bit. I still use a little bit of it in my practice, but I use computerized adjusting. I have an instrument that utilizes adjustments instead of using my hands, which are extremely effective in terms of patient comfort and results.
Tell us about, and we talked about this a little before we went on, I'm interested in it, Calmar therapy, right? And I mistakenly said, being Italian, calamari therapy, and you correctly corrected me right away. Tell us about it's like is it a nerve scrambler?
So what Calmar therapy does, it's a therapy that came from Italy, and it was developed over there. And what it does, it's basically for people that can't get relief from any type of pain, whether they're on opioids, from failed back surgery, knee surgery, shoulder surgery. It doesn't work with arthritis. It only works with nerve pain. And what it does, it scrambles the nerves so the brain is not receiving pain signals, but no pain signals. And the reason it does this is because it scrambles the nerve signal to the brain. When we see patients like 5 days in a row, take a break on the weekend, another 5 days. And each treatment decreases the amount of discomfort. And this no pain can actually last from months to over a year. It's not a cure-all, but what it does, it gives patients a quality of life that they're not receiving otherwise.
So should patients try an alternative therapy before this, or is this something that they can, you know, try this nerve scrambler rather than doing like the medications or the things like that?
Oh, absolutely. We've had great results in treating neuropathy with the Calmar, and especially patients who have had chemo-induced neuropathy from nerve damage. And so it's always best to try non-invasive stuff first before you go the invasive route, and relying on drugs and medications.
So does it wear off after time?
Well, it's been shown to last over a year. And sometimes, you know, patients come in, they just come in for like a redo. Maybe they've had it and they've had the treatment, and maybe 6 months later, you know, I'm still feeling a little twinge here and there, so we just do a redo treatment for them.
How long does it take to do something like this?
The treatments last an hour. The treatments last an hour.
Is it over a long period of time?
No, like I said, we treat patients 5 days in a row, and they lay comfortable on a table. They really don't feel, they feel a little tingling in the joint or wherever we're treating. And then when they're done with the treatment, they'll notice a decrease in their pain. Now, it may last maybe an hour or 2 hours, but the next time they have a treatment, maybe it lasts a day. And then all of a sudden, every treatment builds on the previous one until they find that we take their pain from, say, on a 0 to 10, 10 being the worst, down to a 0 or 1.
Wow. One of the other things that you focus on is nutrition. Tell us a little bit about this.
Yes, nutrition is a very big part of my practice, and basically with my nutritional programs, I know people are looking to lose weight, but the one thing you really have to realize is you need to treat the gut. A lot of people have what's called leaky gut syndrome. And what happens is that because of medications, lifestyle stress, and diet, what's happened is that they develop a lot of food sensitivities because their gut becomes porous, and they have abdominal complaints, joint complaints, and all this stuff. So my nutritional program is designed on healing the gut, and then it's much easier to lose the weight.
That's great, because I hate to go up and say, hi, I'm Joe Chili, I have leaky gut syndrome. Just doesn't go over well with people. Dr. John Zilliox, thank you very much. We appreciate it.
You're welcome, Joe.
For more information on connecting with Dr. John Zilliox at Positive Health and Wellness Chiropractic, you can visit the office at 1408 Sweet Home Road, Suite 3, Amherst, New York. You could call 716-689-3629 and online at these websites, meetdrz.com. That's meetdrz.com. or also buffalodisccenter.com. Sponsorship and promotional consideration for the preceding segment was provided by Positive Health and Wellness Chiropractic.